Hi, everyone, and welcome to our webinar, Through the Fibro Fog, Improving Cognitive Symptoms of Fibromyalgia. I'm Nicole from Swing Care, and I'm so excited to have Dr. Andrea Chadwick and Tami Stackelhouse here to discuss brain fog. We hear from a lot of our patients that brain fog is one of the most frustrating symptoms for them, but it's also often overlooked compared to widespread pain or even fatigue. So today we want to look at brain fog and why it's so linked to fibro, what we can do about it, from medication-based treatment to non-drug approaches to just kind of practical tricks you can use every day. So really excited to be here with both of our experts. Thank you so much for joining us for this. And before I dive in, I just want to share a little bit more about our guests today and their background. So we have Tami Stackelhouse. She's an award-winning author, founder of the International Fibromyalgia Coaching Institute, and executive producer of the fibromyalgia documentary Invisible. After creating her signature fibromyalgia wellness framework to take back control of her life after her own diagnosis, Tami shares her expertise now through her coaching practice, her fibromyalgia podcast, and her award-winning books. So thank you so much, Tami. And Dr. Andrea Chadwick is medical director of Swing Care, a specialty clinic dedicated exclusively to fibromyalgia, and is double board certified in anesthesiology and pain medicine. Her clinical expertise focuses on complex centralized pain syndromes, including fibro, and she is also the director of the Fibromyalgia and Centralized Pain Exploration Lab at the University of Kansas Medical Center. So thank you again. Really excited to have you both. And I was wondering, kind of to start off, Dr. Chadwick, I'd love to talk a little bit about why brain fog is part of fibromyalgia. Widespread pain, is usually the first symptom that we think of, but why are these cognitive symptoms also so prevalent?
That's a great question. And I think, when we look at the history of the evolution of the diagnosis of fibromyalgia, initially when it was, being discovered and kind of researched, they really did focus mainly on that widespread pain. And so I think that's where a lot of that initial focus, not only for clinicians, but also for patients, kind of started. But when we look at the evolution of the diagnosis, the current diagnostic criteria does include those cognitive symptoms, as well as a variety of other symptoms that you mentioned, like fatigue and sleep problems, as part of the actual diagnosis of fibromyalgia. So what we know is that the exact etiology has not been pinpointed, but we do know that, and I believe it to be multifactorial. So what are some of the causes that we could discuss? We could discuss that fibromyalgia is known to be a neurological origin disease, meaning that the central nervous system has developed adaptations in how it processes pain, and that those changes themselves can lead to difficulties with cognition. Additionally, we know that different types of neurotransmitters in the brain, such as serotonin and norepinephrine, are heavily involved not only in pain processing, but also in sleep and memory and cognition. I think when you even take it outside of that physiologic or that neurologic discussion, when we talk about the downstream effects of what pain does to a person, right? I'm not a person with lived experience, and I'm going to ping this over to Tami after I speak, because I really think it's important to get a person with lived experience to answer this question as well. What we know is that patients are getting poor sleep. And they may be getting poor sleep because of pain. They might be getting poor sleep because of those neurochemical issues. But if you think about this being like fuel on a fire, if you're not sleeping, your pain is going to get worse. And you're not sleeping because you're in pain, that's going to lead to more fatigue. And we know that when you're not getting that good restorative sleep, that those neurochemicals that are so important in these processes are not having the chance to get rebuilt. Add on top of that just the mental load of what being in chronic pain can do to a person. I mean, I'll tell you what, I'm a mom of two busy boys, and managing their schedule is enough to make me forgetful. So imagine, again, I'm not a person with lived experience. So after I finish here, I'm going to ping this over to Tami, but the mental load of dealing with and living with chronic pain has to feed into this, because it is so stressful for persons who live with this disorder. Tami, I'd love to hear your thoughts on this as well. I mean, I know we can give this biological basis, but I'd love to hear from you too.
Yeah, absolutely. And it's interesting you mentioned the mental load of it all. And the best example I have of what living with this is like actually happened to me last week. So we all have smoke detectors in our house, right? And when the battery starts to go, it starts to chirp. And it takes you a while to figure out exactly which one it is. And I was home by myself and I'm going up and down the ladder trying to change the batteries, dropping the batteries. Batteries didn't work. By the end of the day, I literally screamed because I was so frustrated. And let me tell you, I couldn't think either, right? And that to me is what living with pain is like. Pain is like that little, chirp from the fire alarm that is just going off just when you think you've had a break. There it is again, right? And so that mental load, that chirping pain, that fire alarm, that keeps us from being able to think. And also, as you said, when we don't get good sleep, we can't think either. Your brain uses a huge amount of energy. And so if you are fatigued to begin with, then your brain doesn't have the energy to deal with that, right? And, there's just so many factors, I think, that go into why we have brain fog. And I mean, it is a symptom in and of itself, and there's causes of it, but it's also a symptom of all the other symptoms, right? When we have a lot of pain, we have brain fog. When we have a lot of fatigue, we have brain fog. We've got our fight or flight, that we're stuck in. And so we have amygdala hijack, which takes our thinking brain offline and reverts us back to, our more base thoughts, which is get out of the house because this stupid fire alarm is driving me nuts, right? So I think there's a lot of things there, but fortunately, I think that means there's a lot of things we can do about it too.
Yeah, and I'd love to dig into that a little bit more. First, kind of understanding what are some of those triggers of brain fog? It sounds like that's so interconnected with other things and sleep being a huge factor. But are there other triggers that, we should think about or be conscious of as we're experiencing it?
Absolutely, absolutely. So, nutrition is a big piece, right? When we have fibromyalgia, we are exhausted, we are in pain. So, sometimes it's hard to eat the way that we know that we should. But, particularly if you're not getting enough good protein in your diet or if you're not getting enough good healthy fats, those are things your brain loves. If your blood sugar is not stable, that will contribute to brain fog. So, nutrition is a big piece. Of course, we talked about sleep, and it's such an important part, but I think for many fibro people, it also feels almost impossible. So, we're not going to talk a lot about that because there's a lot of other things you can do first. And then I do think that stress is a factor, right? So, anything that you can do to help calm down that fight or flight. So, if you are in a more stressful period in your life, or if something stressful is happening, that for sure is going to trigger more brain fog. Also, our lack of movement, which is, to me, with brain fog, is really more about a lack of oxygen to the brain. So that's, we'll talk about some tips a little bit later, but that's one of the things we'll talk about. Just not getting that same level of oxygen to our brains. Yeah, there can, and all of us are a little bit different with our fibro symptoms. And so many of us, like, brain fog might be the first thing that pops up, or it might be the last thing that pops up, right? This is going to be a bigger problem for some people than others. And so it's really important that we start paying attention to our own selves, our own bodies, our own symptoms, so that we can start making those connections for what the triggers are for us.
I will link somewhere, either on YouTube or on Facebook, depending on where people are finding us, some of the things we've explored in some of the areas you mentioned. Nutrition, as you mentioned, such a big piece. And we had Dr. Ginevra Lipton here talking about nutrition with us. So really recommend that kind of deep dive there. And you probably have some tips there as well. Also fatigue. We had also a webinar on just sleep hygiene and how that can be something people can look into when they're in the middle, especially of those stressful moments. So really looking forward to diving more in there. Before I have more questions, I just want to kind of step back for a second and wonder if Tami, you could share, or Dr. Chadwick, from your kind of patient's experiences, like what does it feel like to go through fibro fog? And, I know people have had mentioned problems with memory, problems with concentration. What are some of those kind of more descriptive symptoms of fibro fog, or if someone's wondering, is this fibro fog? Am I having it? What is that like?
Absolutely.
That's a
Yeah.
great question.
Yes. And, speaking as a fibro person, this was the symptom that scared me and frustrated me the most. Because if my body didn't work, if I was too tired, I could at least, sit somewhere and work or read a book or watch a movie. But when you get to the point where your brain fog is so bad that you can't read or work, or like, then what? Right? So that was really for me the worst part of my fibromyalgia. Even though maybe my symptoms of pain and things like that were worse, like my life was worse because of the brain fog. And I think it's also one of the things I always teach my students and my clients is kind of the difference between fibro fog and something like dementia. And I'm sure Dr. Chadwick can talk to this from a more scientific part of things. But if you imagine your brain, your memories as a house, when you have something like dementia, you go down the hallway to the memory you're wanting to access, and you open the door to that memory, and that room, that memory does not look the way it should, right? Maybe the bed's on the ceiling or the drawers are all pulled out. In real life, what that might look like is my grandmother was convinced that my husband has been to the moon. Now, he designs computer chips for rockets and missiles. He's worked for NASA, things like that. So, he's sent stuff to space, but he has not been to space. And so that's an example of something like dementia, where you open that door to that memory and it's just wrong, right? With fibro fog, when we finally get to that door and we open it up, everything looks the way that it should. Our problem is that we can't access the memory. So it's a little bit more like our hallways are full of junk, right? And so if you're listening to this and you're thinking, a lot of my clients are worried, right? When they start forgetting things, when the brain fog comes up, they start worrying, oh no, is this a sign of dementia? You can kind of think of that analogy and think, are you just having trouble getting through the hallway and getting to the memory? Or is the memory wrong? And if the memory's wrong, I would definitely recommend talking to your doctor. There's some, checking they might want to do. But for most of us with fibro fog, we just got to clear out those hallways. And so that's kind of what today is going to be about, is how do we set our lives up so it's not as affecting us as much, and what are some tips and techniques to kind of keep those hallways clear. But for me, it was I don't know. Some of the example I always use is I start spelling things phonetically when my brain fog kicks up. So phonetically would be spelled with an F instead of a PH, like it's supposed to be. But that for me is like a warning sign that my brain fog is starting to get bad. And if I can take a break then, instead of waiting until I just can't do the thing anymore, right? Then I can come back online quicker. But starting to notice some of those things, getting lost, going somewhere you've been a bunch of times before, forgetting appointments that you really wanted to be at. Right? All of these kinds of things, forgetting something somebody told you, it can be very frustrating and very impactful in your life to have those things go wrong.
Yeah, I would say that, again, I'm not a person with lived experience, but I hear from a lot of people with lived experience as a doctor to patients with fibromyalgia. And I've seen quite a spectrum of severity of the fibro fog and the cognitive dysfunction. And I think I'm always thinking of, is there something else that could be at play? Mainly because I think part of the issues I've seen, being a physician in this space is so many people just dismissed of their symptoms as being fibromyalgia when in fact there may be other things going on. That again, the fibro fog might be there, but is there something that's making it worse? Is there another factor at play? So I'm constantly thinking, are we dealing with vitamin dysfunctions? Things like vitamin D deficiency, B12 deficiency can cause memory issues. So I'm always looking to check those things, making sure thyroids are checked. More recently, and again, I'm very grateful that I learn from patients every single day, but I'm learning that there may be links with some more neurodivergency type spectrum issues in patients with fibromyalgia. And so are we looking at, adult onset ADD or other types of neurodivergency issues that really could be addressed by seeking specialty treatment for that? And if I'm very concerned, I will refer for formal neuropsychological testing because with that extensive battery of tests, sometimes it may play out that there is a different type of executive dysfunction going on that is above and beyond what you would expect from fibro fog. So I think it's so great. And I love these webinars when we have persons with lived experience and a clinician, because we get to talk about these things in ways that patients, I think they're going to listen to me, but they are going to learn so much from Tami. And there is so much that a person with lived experience, has in this space, because I don't have fibromyalgia. I treat it every day, but I love partnering with people like you, Tami. And I just want to applaud the work that you do in this space because it is so necessary.
This topic of ADHD in fibro patients has been coming up a lot with some of my students and some of my clients. And I know that there have been studies that have shown that fibro fog can mimic ADHD, but do you have any guidance on when that might be more of an actual diagnosis, when that's just fibro fog, or do we not know?
I actually think, and it's interesting, I've learned more about neurodivergency from TikTok. I'm just going to be honest, from watching TikToks and learning about all of these different types of neurodivergency diagnoses. And I've started asking my patients more and more about it, mainly because it's really piqued my interest. I don't think we have a lot of good data about the correlation or what the prevalence is, or is the incidence, does it onset in childhood or adolescence and then it's just undiagnosed for many years? Or is the onset of ADHD more prevalent with the fibromyalgia diagnosis and the development of the condition? I wish I knew the answers, but I'm hopeful that there are good researchers out there who are starting to look at these associations because, again, as a fibromyalgia physician, like to Dr. Lipton, there's very few of us across the country that do this. And so many of us are just kind of flying on with our anecdotal evidence, hoping someone figures it out. But I think the fact that we can talk about it here today might put it into the minds of the people who are listening, the broader community, to say, hey, I am having some symptoms that may sound like ADHD or ADD, an attentive type. Maybe it'll pique a conversation with their primary care provider to be able to look into that diagnosis. Because I have had quite a few patients tell me they think they have it, and then we've sent them for testing since I'm not able to give that diagnosis. And lo and behold, they had it. And many of their symptoms did improve as they got treatment for that.
Thank you. Yeah, it's interesting to talk about these symptoms that may appear like fibro fog or cognitive symptoms, but have some other cause. And I also wanted to use that to kind of segue into treatment, because we hear from so many patients that the same medications they're taking for fibro itself are also having sort of similar effects, cognitive effects, that sometimes ultimately lead them to stop taking the medication. And I was just wondering, maybe Dr. Chadwick, you can start. Are there particular medications that have these kind of cognitive side effects? And what about ones that can actually help treat some of those cognitive symptoms?
That's a great question. And again, this is kind of like the double-edged sword of what I do is many of the treatments that help with the pain and associated pain symptoms have those downstream effects of cognitive disturbances themselves. And so, most of the treatments we have that are either FDA approved or off-label indications for the treatment of fibromyalgia are what we call CNS depressants, meaning they depress the central nervous system in some way. This could be something like a gabapentinoid, which would be gabapentin or pregabalin. This could also be in the drug class of some patients who take like a skeletal muscle relaxant. So something like a cyclobenzaprine or a tizanidine or a methocarbamol. Now there's varying results that patients have on whether or not they get these cognitive and kind of sedative properties. And a lot of it boils down to how their liver and kidneys process and, kind of excrete these medications. But I would say those are probably the ones that are the biggest culprits. If you look at some of the antidepressants like duloxetine or milnacipran, those actually tend to cause less sedation, less cognitive difficulties, but still have the possibility of doing that. Again, if a person is very slow metabolizer of these drugs, they may clear them, much longer than someone who has a more normally functioning enzymatic activity. And so those persons may get more side effects just because they're not excreting the medication the way that they should. So, it doesn't mean that there isn't utility for these medications, and it doesn't mean that all persons experience these side effects. And this is why the art of fibromyalgia care is really fine-tuning and giving personalized medicine to each person you see. In terms of medications that cause less dysfunction, I would say the one off the top of my head that I use the most regularly is something called low-dose naltrexone. Doesn't tend to cause many side effects of anything in anybody that I treat it with, but occasionally, again, with those slow metabolizers of that specific pathway that does the metabolism of that medication, they may be more prone to side effects from that. So again, that's when we tailor the dose to the patient.
I love that you ended with that statement, tailoring the dose to the patient. I had a client years ago who was on Lyrica who really needed it for her pain, and she needed it during the day, but it made her too foggy. And she was a medical professional, so she needed her brain, right? So one of the things that she worked out with her doctor was splitting her dose instead of in half, one third and two thirds. So she would take, let's say, 200 at night or whatever it was, and 100 in the morning. So two thirds at night, one third in the morning. And for her, that gave her the pain support that she needed during the day without making her brain too foggy. So things like that, like really explore with your providers, like what tweaks can be made. And, even though a lot of these medications work in similar ways, gabapentin, Lyrica, very similar, but the reaction that you may have to them could be completely different. So, I think it's really important to not just accept all the stories. I mean, it's information, sure, but that doesn't mean it's going to affect you a certain way. One might work better than the others. You might not have the side effects at all. So definitely it is worth trying and doing that tweaking to get what you need for your situation. Yeah.
And then I know when we're talking about treatment for brain fog itself, we're usually talking about non-drug treatment, but are there any medications that people use for the brain fog itself?
If there was one, I'd be prescribing it. That there is no FDA approved agent that I'm aware of for, the cognitive dysfunction related to fibromyalgia. Now, certainly, are there medications that can help with fatigue that then might help with mental clarity? Or is there the possibility of utilizing medications for their sleep side effect so that you are getting that restful sleep that then in turn might help the functioning of the brain during the day? So, like I said, if there was a medication, I would be prescribing it. But as far as I'm aware, there is nothing that is specific to this. And again, it's just tailoring the medication to the patient. And, I know, and I'll pass this off to Tami after I say it, but, a lot of patients feel that, the care is like throwing darts at a dartboard and you just hope something sticks. And I recognize how frustrating that might be for a patient, but I do really want to echo what Tami said when it comes to not listening to the stories that others tell when it comes to medications, because I have patients who swore, oh, I'm not going to try that because my mom took it and she had these horrible side effects. Um, each person is so different. And again, it comes down to that intrinsic way that our bodies process medications, our intrinsic neuropsychopharmacology, fancy words for saying each person is so different. So I think it's definitely important to look at all the aspects, all those facets of fibromyalgia, talk to your provider about them. If sleep is one of the major issues, maybe that's where we start. If the pain can be, if the pain is related more to lack of sleep, then I usually talk with patients about starting with how can we get your sleep better? And then that might help in turn the pain. It's all such a interconnected thing with all of these different symptoms. But Tami, I'd love to hear from you about this as well.
Yes, absolutely. And I'll just add on to what you said there that, we were just talking about ADD and ADHD. And if somebody is on the edge of that or has a diagnosis of that, those kinds of meds could potentially help too. So we
Absolutely.
have to expand what we're looking at beyond just a fibro box, because all those other things that we have, I've dealt with headaches since I was really young. And so for me, keeping my headaches managed is a key piece of keeping my fibro managed, right? It's not just about fibromyalgia in a box. So all those other medications that help with those other things could be the answer to your
Right.
fibro fog, right?
But you don't, but the thing is you can't get there unless you have a clinician or a team of clinicians who are willing to not only work with the patient in that personalized manner, but also work as a concerted team for all of those different issues. So I always advocate to patients, make sure, especially if your providers are in the same health system, we all should really be talking to each other about how we put the puzzle pieces together for each patient. And I love that you bring that up, that it's like it really should be tailored towards everything else plus the fibro. And I think this is where I always tell any learner who comes into my clinic, it's fibro and like, it's like that Ariana Grande song, like, yes, and like, it's not the only thing that patients are dealing with. And when they revised the diagnostic criteria in 2016, they got rid of the question about, is there something else that can explain the pain? And that's because we know fibromyalgia can coexist with anything.
Mm-hmm. Absolutely. Absolutely. And I always talk about fibromyalgia as being an amplifier. And I think that's true of brain fog too, right? So whatever else you have going on, fibro's going to take that volume knob and just crank it up. So we've got to look at both the fibromyalgia and everything else that's going on.
Thank you for sharing that. And, one of the things I think we talk about the frustration around brain fog, it's because one of the reasons is because there are so few recommendations from most primary care doctors or, even specialists that people are going to for the brain fog itself. So when we're talking about medications, we're kind of at a loss, and that's often, where the conversation starts and stops around treatment. And so now I'd love to kind of turn the conversation to some of the non-drug approaches that Tami, you've seen with your clients, and Dr. Chadwick, you've seen with your patients that have really moved the needle. Maybe Tami, we can start with you.
Yeah, absolutely. When I wrote my first book in 2015, I did not include a chapter on brain fog because, to be totally honest, I didn't have a whole lot to say, right? There weren't a whole lot of things to do. And when I updated the book and wrote the new edition in 2022, that's one of the things I added was a chapter on brain fog, because in those, 5 years, 7 years, I had learned so many other things things that can help. So we're going to talk about some of those today. But if it's okay with you, Nicole, I'd love to give those links right now. So I do have a podcast episode that is all on brain fog. So the Fibromyalgia podcast, you can find it in your favorite podcast player or on our website. It's episode 46, fibromyalgiapodcast.com/46. You'll find that episode. And also on that website, you can download free copies of my book. So if you just go to resources in the menu, you'll see Take Back Your Life is one of the books. That's the book where I added the brain fog chapter. So, but with that, I'm going to give you today really 2 tips to help prevent brain fog and 2 tips for what to do when you find yourself in it. So when it comes to preventing brain fog, the way I like to think of it and the way that I work with my clients is, how do we set up our lives so that it doesn't matter if you have brain fog or not? So what I mean by that is things like, don't hold it all in your head, write it down. Put it on the calendar, make that to-do list. Use your GPS, even if you're going somewhere that you already know. Use things like alarms, timers, all of those kinds of things, so that if you do have a moment of brain fog, it doesn't matter, because you've got your little checklist right there and you can just go on to the next thing on the list. So anything, like when I'm doing a new podcast episode, for instance, I've got a whole checklist that I go down for everything that I have to do and just tick it off. And just last week, my assistant and I found something that we missed because of the checklist. Yay! So set your life up in such a way that it doesn't matter so much if you have brain fog. And, just like medication, this is going to be unique to you. This is a lot of the work that we do as coaches with our clients. But think about how, whenever you run into a spot like, okay, where are my keys this time? Well, one of the ways that you could set up your life so it doesn't matter is you always put your keys in the same place. Just one example. All right, the second tip I have for helping to prevent brain fog is no multitasking. Multitasking is not for fibro people. And if that was you before, it was me before, that's one of the things that you're going to have to let go of. I used to manage the call center for a software company, the support department. So talk about multitasking. I had all these people, all these phone calls, all these things I was keeping track of. That is not something I can do with fibromyalgia. So that means things like my phone is on silent all the time. I check my phone when I'm ready to check my phone instead of having my phone interrupt me all the time. Remember that smoke alarm, chirp, chirp, chirp? All those notifications is like that smoke alarm chirping and taking you off task. So think about how you can limit your multitasking. That might be something like time blocking, if you've heard of that. That's where you sit down and you spend a certain amount of time doing one task, like just answering your emails. Or, even if it's just sitting down and enjoying Facebook, right? That's better than trying to switch back and forth, because as fibro brains, we don't do that task switching very well, and it takes us longer to switch tasks. So think about how you can not multitask. Make sure you give yourself extra space for that task switching, which may even be things like, okay, I get done with the webinar we're recording right now, and the next thing I go on to, make sure I have enough space there to let my brain sort of clear one thing, start another thing. The other thing that I would say, just sort of a 2.5 tips, start noticing your warning signs. So like when I said I start spelling things phonetically, once I really started paying attention to that, I was able to catch it quicker, recover quicker. But if you're not paying attention to those warning signs, then just like your pain flares, your fatigue flares, your fibro fog can get really bad. Okay, so those are my 2 tips for prevention. These are my 2 tips for recovery. So the first one is calm down that fight or flight. Usually when we're in the midst of a brain fog, we are also in the midst of stress, even if it's just stress about the brain fog. I mean, let's be real, right? So anything you can do in that moment, just take a minute, calm down, step outside, pet the cat, walk around your living room for a second, whatever it is, just to calm everything down. Take that break, stop pushing through. And then my second tip is increasing that oxygen to your brain. I mentioned that earlier. And this can be as simple as doing some deep breathing. I was excited a while back to see a study that they found that deep breathing increased oxygen to the brain, even at high elevations where there isn't much oxygen. And I thought, hey, if it works for them, it'll work for us. Right? So making sure you get those good deep breaths, getting oxygen flowing to your brain. If you can, move your body a little bit. And I'm not talking about anything crazy. I'm talking about take 60 seconds and walk around your kitchen island or your, coffee table in your living room and just get that blood flowing. Oxygen also, if you're inside a lot, and a lot of us are, then that can increase the carbon dioxide. We're not getting oxygen like we should. So open some windows, get some fresh air. So my 2 tips for preventing, stop that multitasking and set up your life so it doesn't really matter if you have brain fog or not. And then my 2 tips for what to do when you get into it. Number 1, calm down that fight or flight. Try to get your thinking brain back online. And number 2, increase your oxygen.
Those are great. Those are amazing.
Thank you.
I don't know how much more I can add to that amazing list, but let me just kind of share some that I've talked about with my patients. The first one, it kind of goes in line with what you talked about, like not multitasking and like keeping things simple in your brain. Also, the idea that we need to like get out of that fight or flight. So I think taking breaks is very, very important when people are needing to be on task. And so I've often recommended something called the Pomodoro method for working. I use it myself. So
Big fan. Yes.
I've never been formally diagnosed, but I would venture to guess that I am actually a bit of a ADD and attentive type of person, somewhere on the spectrum of that. And I found when I started my academic career, which involves, a lot of manuscript writing, grant writing. I mean, I am like a vortex into this document in front of me. There's words everywhere. I'm managing a bibliography. I'm checking PubMed to figure out what I need to put in there. I found myself just getting so overwhelmed that I was stuck in freeze. I could not even get words onto paper. But I found that when I put my do not disturb on my computer, put my phone on all of it, all these things link now. So if it's on do not disturb on your computer, it's going to be do not disturb on your phone, your iPad, everything else. And then using that Pomodoro method, if you just Google it, it'll teach you how to do it. But essentially, it's taking small breaks between specific task-based items that you focus on in that span of time. And so I actually tend to write out each hour by hour how my day is going to look and what tasks I'm going to complete within my different Pomodoro chunks. And then between those breaks, I try to give my brain just like what I call mush time. I don't know how else to describe it other than I'm not doing anything that takes a brain cell, right? It could be choosing to maybe fold some laundry, which for me is actually a very soothing thing. I get a big sense of control out of making, shirts look nice in a pile. Or sometimes I'll actually just go doodle on a paper, just like let my pen go where it needs to go. And then I find that if I let that mush time, occur, then I'm like really laser focused when I get back because my neurons have had a chance to just chill, right? So that's, I would say, a big one. And then I think there's just something that comes with looking in the mirror and saying, I give myself grace. And I talk to my patients a lot about this because many patients have told me how they just had this life before fibro and that is like the benchmark that they want to get back to. And if they don't meet that benchmark, they are somehow a failure or they aren't attaining their goals. And I think that's probably a whole topic for a separate podcast that we could talk about, which is, I think, the grief and grieving process of the diagnosis of fibromyalgia. But on those bad days, or even on those good days, looking in the mirror, giving yourself grace, having that positive self-talk is so important to being able to just move on from that experience. And I'll leave it at that.
Yes, I agree with both of those things so much. We have to walk this tightrope between accepting our illness and living in the body that we have right now today, right? Not being in denial, but also that hope for a better future to get back to the life that we want to live. And it can be a tricky thing. So, absolutely that. And I want to give, I love the Pomodoro Technique. I wrote both my books that way. So, it's so funny that you were talking about that. And I want to give a couple Fibro specific tips when it comes to Pomodoro. So, the Pomodoro Technique was set up to be 25 minutes of work, 5 minutes of break. And I think for Fibro people, that ratio is not quite right.
Definitely off.
We need shorter work times, longer breaks. So if you are thinking of trying this, again, give yourself that grace and just know that you might need to work less and break more. I had a client that was working on cleaning out her closet, and I think she would work for 20 minutes and then rest for 15 or something like that. The idea is that you take your break before you get to the fog or the flare or the whatever, right? We want to stop while we still feel good, which is so counterintuitive to most of us because we're like, oh, it's a good day, I have to do all the things. But we need to stop before it gets bad. And then you can take your break and then you can go back and you can do more. And you'll actually get more done than if you pushed through.
Yes, I appreciate that. And I'll link to Pomodoro in the chat as well. But please keep Tami's tips in mind for how to adapt it for fibro. I love that. I feel like that's a blog post waiting to happen. I'll need to pick your brain about this, Tami.
Absolutely.
And also kind of recalling what you said too about breathing. We had a great conversation with Corey McGuire, who's a pelvic PT, but also specializes in chronic pain. And that was kind of the biggest kind of takeaway for me. The webinar was supposed to be about, movement. And really the first thing she said was movement. What we're talking about is we're really talking about breathing. And that's why movement, even though it can be so challenging, can really be a foundational part of fibromyalgia treatment, because really starting with that breath can help, not only the pain, but also these other really troublesome, disruptive symptoms that affect us cognitively as well. And we do have some good data on this. One of the things that we looked at with the Stanza app, which goes through not only, pacing and breath work, but also this type of cognitive behavioral therapy called acceptance and commitment therapy. One of the endpoints that was looked at in those studies was around memory and concentration. And so seeing not only, people were improving holistically and overall well-being, but also in these specific cognitive symptoms. I was looking at the most recent study, and 68% of people who progressed with the Stanza app actually reported improved memory as well. So really looking at how all of these things function together, like you said, but also in a personalized way. Everyone is kind of affected differently. So thank you for sharing, Tami. One of the things I love about your podcast is also how organized it is for my brain. That is very helpful. We're just like, here's are the 2 tips. These are the 2 other tips for like more in the moment support. So I love that about all of your work. Thank you.
Thanks.
And as we're wrapping up here, I just wanted to see if there are any things that you recommend people do, especially when they're in flares. We know that flares are, brought on by some of these triggers we were talking about.
Well, speaking as someone who's been there, done that, I think the biggest thing that you can do in those moments is to give yourself that grace and to remember that this isn't forever, right? Yes, you're in a flare. Who knows how long it's going to last, but at some point it will end. And one of the things I see so often as I'm working with clients and helping people get better, they're so excited about feeling better, and then they have a flare up, and it's almost worse than if they had had the flare before, right? Because they feel like I've done all of this work, I'm starting to get better, and now it was for nothing. And we really need to guard against that all or nothing. Now I'm a failure kind of thinking. It's a season. Our goal is maybe eventually someday to be pain free, fibro free. Mine's in remission, but it took me a long time to get here. Our first goal, though, is just to have those flares be shorter, not as severe, and farther between. So when you have those times where you have a flare, I mean, I'm a science-minded person. I love data because data doesn't lie to me. So I can look back and see, oh, look, the last time I felt like this was then. That's been 3 months. That's longer than I've ever gone before. And using those actual facts. The other thing that I think is really important is community, other people who have been there and experienced what you've experienced, who can come alongside you and say, I understand, I've been there, and to kind of encourage you and give you that hope. There's something, I mean, I love that Dr. Chadwick is treating patients, but it's different when it comes from somebody who's been there to say, it'll get better, right? Because there's like an added weight to that of our own experience. So those are really the things that I would recommend. Of course, there's a ton of practical stuff too, but you can't get to the practical stuff if you don't give yourself a break, right? If you're so wrapped up in the, oh no, I'm in a flare, life is over, everything I've done is pointless, it's never going to end, then it's really hard to do the things you need to do. So start there.
I'm going to second the grace that I brought up in the last question. I think there's a lot of stress that comes with feeling like, oh gosh, the flare is coming. What did I do? And I have patients say, what did I do to make this happen? And most times it's nothing that the person did themselves. It's something completely uncontrollable. Life is just like that. And so I probably say the word grace like 100 times a day when I'm in clinic, because it really is something that I really want my patients to accept and learn and practice on a daily basis. And when they're in their flares, knowing that they have me as a partner, if they just need to reach out and say, hey, is there any little tweak we can make before I see you again? Knowing that if you have that provider partnership that you can tap into, but that community is so important. And I have quite a few patients who have both a fibromyalgia community, but also their own personal support network that they can lean on during those times. I have a patient who's got really bad rheumatoid arthritis and fibromyalgia, and there are days where she literally cannot get out of bed, but she has a whole network in her community of people who can help her go pick up her kids if she's having a bad day. Her husband is super supportive. She's got supportive parents. And I know not everybody has that, but if you do connect with others who have fibromyalgia, they might be able to help be part of your village as well.
One more thing I was just going to add. One of the things I have my students and clients do is create a flare survival plan. And the important thing about this is you can't do it when you're in the flare. You have to do it when you are clear thinking, when you're not
Right.
totally exhausted. So take the time when you feel good to think through, what are the things I can do? Because when we're in a flare, we cannot think of the things. We might know all the things, but like they're gone. And
Right.
so actually writing out this, for me with my headaches, I mentioned I have chronic headaches. there are certain medications, if my headache is lower, work better, and other medications, if my headache is higher, those work better. So like writing those things down, putting them on a piece of paper, sticking them on the fridge. I actually did this with a client who was going to have her tonsils taken out, and she knew she wasn't going to be able to communicate with her fiance, and so it had to be in a place where he could see it too. And you can also sit down with the people who love you and say, okay, here's the symptoms that start to show up, right? Here, if you see this, this is the kind of help I need. And what else could you do? You will be amazed at the things that people will help you with once they know more specifically what kind of help you need. When you're in the flare and you say, I just help me. Like, what do I do? I don't know. But you can have that conversation clearly when you're not in the midst of that flare. All kinds of good stuff comes out.
Well, and I teach my patients, that's a really good point. I think oftentimes, even myself, when I get discombobulated and overwhelmed, like I'll just text a friend and I'll just dump on her everything I'm dealing with. And this friend she actually taught me this, her response was never to address what I actually wrote. It was, what can I do to support you? And so I've taught patients, maybe if they haven't written that plan yet, to teach those that they love around them, if they are in that space where they can't vocalize their needs, that their support network needs to be able to say those words. What can I do to support you?
And don't be afraid to have it be dumb little things either, right? Because sometimes just, I need to curl up on the couch and have a cookie. Sometimes that really is the answer.
Yeah, and last time we talked about, I think Lynn Maddalena brought this up, kind of having a code word where it's just like, hey, I don't even need to get into this right now. I just have to tell you that this is code word. You know how I'm feeling, and you know how you can help right now. And having that conversation preemptively is really helpful. So I know we have to wrap up, but thank you so much. I think people have such a wealth of new tricks from this webinar and lots of other things to explore too. So I'll put a bunch of links of things we talked about here, so you can continue to look into those, and also use this community here as a resource. If you're watching this in our Life with Fibro community, we love having you, and I encourage people, if you aren't viewing it there, to check us out on Facebook. And Tami, can you share a little bit more about just where people can find you?
Yes, absolutely. So the Fibromyalgia podcast is really the best way. We have episodes every other week. I have had Dr. Chadwick on, but I also share some of the tips and tricks from my own life, and interview clients and other coaches and things. So there's a lot of good stuff on there. You can just search for the Fibromyalgia podcast in your favorite podcast app, or go to fibromyalgiapodcast.com. You can listen to all the episodes for free on the website. They're all there. And that's honestly the best way. You can get to me for everything else from there. Make sure you check out the resources menu. There's a bunch of free resources in there, including books, the Fibromyalgia Wellness Style Quiz, a bunch of other fun things.
And Dr. Chadwick, where can folks find you?
Well, they can find me on these webinars, which is so fun. We hope to continue to do these. Patients can find me at the University of Kansas. That's where I see patients. We also have a Facebook page for my research lab, where you can sign up to be part of our research registry, and that's Face Lab on the Facebook.
Thank you. And I'm Nicole from Swing Care. So thanks for being here for this webinar, and we look forward to seeing you next time.